Well, I appreciate the opportunity to speak to everybody. And this is actually something that's kind of very dear to me because I do a lot of preventative work for both cardiovascular disease, diabetes, and then in the functional medicine world, um, there's a lot of other alternative ways that we address why people get sick. So today, just want to sort of have some understandings and some objectives for today. Really understanding what COVID-19 is, what our immune system, is, and the aspects of the two different components of it. Um, and we'll talk about some numbers for obesity, diabetes, and cardiovascular disease and some risk factors. And actually, we'll talk a little bit also about just risk factors for women specifically. It is something that in our practice we do see a lot of women both for hormones, and one of the big things I always talk about is cardiovascular disease in women. But then also understanding how these chronic diseases interact with COVID. What are some preventative measures and things to know as you step away from today that you can then go out to your community and to even your providers and talk to them about. And then from a functional medicine side, I'm just going to mention 11 supplements and nutraceuticals. There's a lot of vitamins and supplements, and sometimes understanding what you're taking, why you're taking it, and how it actually relates back to COVID is something that we focus on. So I thought I'd share some of those, and we can share that afterwards as well. So I will go ahead and jump right in. So many of us have already seen this virus and the pictures of it, but in essence, COVID-19 is a very simple single-stranded RNA genome virus, and often you'll hear people talk about, oh, this virus is so smart, it's causing it. Viruses in general are not smart. Their only function is to replicate, meaning they want to make copies of themselves. And so it is a very effective virus at doing that right now. And this is, just the structure, very simple. It has what we call a bilayer of lipids, which are fats, and then it has a membrane, and then this envelope that has these little spikes on it that when you look at it, gives the name corona virus. But those are areas where we're looking to target this virus for treatment. So currently, this is of this morning, we're still heading in the wrong direction. There's a lot that we need to do still. And I won't go through these numbers, but these are from the CDC and both Johns Hopkins that have great resources. So in our state, we've passed that 2,000 death mark, which is unfortunate. And we're seeing still numbers increasing in North Carolina. In the Hispanic community that I also serve, we're seeing about a 40 to 45% positivity rate. And so that's also alarming to see. So what does this virus really do in the system? So let's talk about the immune system. There's two components to our immune system, the innate or the general immune system, and then what we call our adaptive or acquired immune system. And that innate or general immune system is sort of that first line of defense. If we're exposed to a virus, a bacteria, it's that quick line of defense. It triggers production of white blood cells, among other cells, but we'll keep it simple. But the real goal of that initial defense mechanism is to kill whatever is coming in. And so it does this by producing multiple substances, things as you've probably heard of, cytokines, but other things, tumor necrosis factor, which can elevate the temperature in your body. It's a defense mechanism trying to kill whatever's offending your body at that time. Interferons, and then other substances that produce an inflammatory response and trigger what we call kind of an oxidative stress to whatever pathogen or problem is going on. Again, the goal is to try to kill early. When we're not able to do that right away, we start recruiting or activating our adaptive or acquired immune system. And this is more specialized, more targeted, and really two big components to this, which are our T cells, which are basically killer cells, and then B cells that help to trigger our antibody production. And antibodies, they're multiple, but big ones that you've probably heard of, IgM, IgG. this is that system that's really triggering kind of that immune memory after the initial responses have been mounted against this pathogen. So ideally, what we like to see is we're exposed to something, we mount a response, we mount a memory, and so if we're hit with that again, we mount that memory response much quicker. That's how often vaccines are targeted to work and are very effective for that. Sometimes that memory can be lifelong, like measles and mumps, or it can be yearly. For example, with influenza, and we have to revaccinate because of changes in that virus. With COVID-19, the jury is still out as far as what that vaccine may do. We're hoping it's longer term. The rumors are that it's probably going to be shorter term, and we're going to have to do, maybe a series of vaccinations. So what about COVID-19 and how does that you guys lose me a second ago? So with COVID-19, the thing to remember is that it is a novel, or what we call a new virus. So our system has not seen it before. And so we don't have an immune memory response built in. And additionally, this virus seems to activate a real aggressive grouping of proteins called the NLRP3 inflammasome, which we'll come back to. But while we've never seen this virus and we're not mounting a memory response, all these other inflammatory responses that occur with our innate immune system happen. So the inflammation, the oxidative stress, the white blood cells being produced, cytokines, all this pro-inflammatory response is still occurring and can sometimes occur so aggressively that we have this, what we've termed cytokine storm. So just to shift gears a little bit, let's shift to cardiovascular disease, obesity, and diabetes, and then we'll put these two things together. So currently in the US, we have about 160 million Americans who are either obese or overweight. So we're nearing almost the 50% mark of our population having obesity or being overweight. In 2020, that's the prevalence is hovering right around 42.4%. And as many of you know, there's a lot of conditions that are related to being overweight and obese, heart disease, stroke, type 2 diabetes, and even certain types of cancer. And as you can see on this map, unfortunately, the swath is in the southeast as the numbers continue to increase. So what about diabetes? Well, unfortunately, it is following that same trend as obesity and overweight is. So as of February of this year, we had about 34.2 million Americans, that's about just over 1 in 10, having diabetes, and that's type 2 diabetes. And then about 88 million Americans, close to 1 in 3, have prediabetes. Now, prediabetes is typically asymptomatic. However, both diabetes and prediabetes can be associated with an increased risk of heart attack, strokes, and other cardiovascular disease. So diagnosis of type 2 diabetes, there's really 3 ways. We look at your fasting sugar on 2 separate occasions, and anything greater than or equal to 126. You can do a 2-hour glucose tolerance test where we give you a load of glucose to drink, and then we measure your sugars. Or looking at a 3-month average of sugars, which is hemoglobin A1C, and if that's 6.5 or higher, then that is, again, diagnostic for diabetes. And so what about heart disease? So following the progression of obesity, diabetes, heart disease. So heart disease is leading cause of death for men, women, and most racial and ethnic groups in the United States. In the US, we have about 647,000 Americans who die from heart disease and its complications. That's about 1 in 4 of every death in the United States. And specifically to women, cardiovascular disease now is the leading cause of death in women. 1 out of 3 female deaths in the US is because of cardiovascular disease. And, not to minimize breast cancer, ovarian cancer, uterine cancer, which are truly, truly, can be catastrophic illnesses, and we want to be able to identify them early. But women have a much higher risk of dying from cardiovascular disease than those three types of cancers combined. And so sometimes, especially in women, that knowledge may not be there as aggressively shared, and it's something that is truly, truly a major issue in women. There are risk factors that both men and women share. And those are the classic ones, such as high blood pressure, high LDL or bad cholesterol, smoking, and certainly, about half the people in the United States who develop cardiovascular disease have one of these three things going on. But, risk factors such as stress, physical inactivity, again, diabetes, being overweight or obese, our diet, and then other inflammatory diseases, how they can trigger inflammation and subsequently develop cardiovascular disease is a risk factor. Specifically in women, we want to look at some other, what we would call non-traditional risk factors. So women who have had preterm delivery or have had elevated sugar during their pregnancy or elevated blood pressure, autoimmune disorders, which tend to be more present in women, another risk factor. Breast cancer treatment. So even treatment post-breast cancer, cardiovascular disease can increase. And then depression in men and women, both a serious problem, but seems to be maybe more linked to a cardiovascular issue in women than in men. Now, another risk factor for women, of course, is menopause. So when women enter menopause, they lose that estrogenic protection that estrogen tends to bestow. And so you seem to have increases in blood pressure, cholesterol management often starts to happen, and starts to occur in that menopausal time. Weight changes can happen during that time. And so there's certainly a time where you see this sort of bump during menopause of an increased cardiovascular risk in women. So now kind of bringing these things all together, how are these all interacting? So let's go back to just, you have a cholesterol disorder. So you have elevated bad cholesterol going around in the blood. And actually what happens is your body interprets that LDL as a pathogen, if you will. It's an external thing that shouldn't be there. And so your innate immune system actually responds to it. And it activates white blood cells to kind of come and gobble it up. And it's doing so in the wall of your artery, right? So that white blood cell is trying to gobble up that bad cholesterol, and at the same time is producing all those other inflammatory things that we talked about, the cytokines, the interleukins, the tumor necrosis factor, increasing temperature in the artery wall, causing stress in that artery wall, and then clumping together in the wall itself, leading to what we call plaque. And that's really where now this disease of what we call atherosclerosis starts to take place, and the cascade of cardiovascular disease is now well on its way. The unfortunate thing is that we see these inflammatory responses in diabetes, in obesity, in high blood pressure, again, in autoimmune disorders. If your diet is highly inflammatory and poor, high stress, and even with poor sleep, you can see this inflammatory response. And additionally, if you remember back what I said about COVID, activating this grouping of proteins called the NLRP3, diabetes and obesity, there's now a lot of research being looked at that they also trigger a response of this quote unquote inflammasome. So the message there is that all these chronic diseases are triggering a high inflammatory response in your system. So what happens? You're walking around with a chronic disease such as high cholesterol or diabetes. Additionally, we're all stressed. Perhaps we're not sleeping as well as we need to. Our diet's not as good as it needs to be. We're not exercising. You get exposed to this virus and you get the disease. So now you're taking a system that's already under a high inflammatory burden, and we throw a jet fuel on it that we've never seen. And so now the resulting kind of process is this augmented inflammatory cascade that's triggered with this virus, and that then leads to this kind of overwhelming and sometimes fatal cytokine storm or respiratory failure. But again, it's that combination of those two inflammatory pathways basically, kind of exploding. And this is being seen. So now looking at case studies, and as we progress from COVID and into post-COVID time, there's been a lot of data coming out looking at not only diabetes and other risk factors, but really looking and analyzing case studies. And I think we're going to have just so much material coming out in the next years on this. But a recent one that came out in JAMA, where they looked at 5,700 patients who had COVID-19 in the New York City area. 3 most common comorbidities were hypertension, obesity, and diabetes. And worse of it is that in patients who died or had acute kidney injuries that required either dialysis or even transplant, they were most likely to have diabetes. And so again, it just confirms the fears that we have around this, and sort of refocusing on how do we address chronic disease, which are completely preventable. I mean, obesity, being overweight, and type 2 diabetes are certainly, I would say, almost 100% preventable. There's a lot that we can do for it. So what are some strategies, I would say, for prevention and strengthening? So for COVID, it's not rocket science, it's simple stuff. In epidemiology, often, the simple things actually work the best. And so hand washing, facial coverings, distancing, quarantine when appropriate, and disinfectant use when needed are just the baseline things that we need to do. Again, in functional medicine, one of the things we focus on is food as medicine. So using food as an anti-inflammatory process. So trying to decrease our sugar intake, our processed foods intake, decreasing alcohol, really working on increasing green leafy vegetables, cruciferous vegetables. Now, we could expand and spend hours on that, but that's just scratching the surface of things that we could do. Stress. Stress makes us more susceptible to both viral and bacterial infections. And not only that, often stress will affect how we respond to something that is attacking our immune system. So really working on learning meditation, learning breathing techniques, giving our system a break is real important to allowing us then to respond appropriately when we need to. Sleep, restorative sleep, more and more, there's lots of research coming out. It's the time that your brain basically, in essence, cleans itself as you're sleeping, but also allows your body to recover. There's a lot of inflammatory things that are removed while you're sleeping. And if you're not sleeping well, you're not feeling rested, or you have sleep apnea or other issues, then that is going to affect how that kind of inflammatory response occurs. Exercise, and exercise obviously to YMCA, you all know, but moderate types of exercise, you're going to reduce oxidative stress, you're going to increase kind of nitric oxide, which helps that vascular wall, helps to reduce your cortisol stress response. And so, I'm a big believer in exercise, and I see, ultra athletes and those types of things in our clinic, but not everybody needs to be that ultra athlete. And there's some data even saying, those sort of high intensity may not have that benefit on the inflammatory response that we want. So moderate intensity, varying the intensity, weight resistance, et cetera, are real effective ways to help that system. So what else, to do? And these are sort of take-home things that you can, take home to your family and to your providers is, number one, knowing your numbers. So, blood sugar or glucose and LDL bad cholesterol, those are basic things that are on all our blood panels. But if you want to take a deeper dive into other markers of cardiovascular risk, many providers are now very familiar with them, but looking at things such as an advanced cholesterol marker panel that has ApoB or LDLP or a high sensitivity CRP, and then there's others there. looking at hemoglobin A1C, which is that 3-month average of your sugars. So looking for a broader picture to be able to sort of see, hey, where am I on this risk platform? Knowing your anatomy. So, there are simple non-invasive tests to look at your arteries, things such as a CIMT, which looks at your carotid here, a coronary calcium test, which is a simple CT scan that's just looking at the heart and the arteries around the heart. That lets us know, do you have any plaque? Do you have disease already? Because if you do, then we really want to step up how aggressively we're looking at these things. Knowing your history and knowing your family. That means, talking to family members, understanding, was it cardiovascular disease because of diet? Was it smoking? Was it something else? And so having those conversations is important. And then knowing your future. That sounds kind of wishy-washy, how to know your future, but it's understanding, especially for women, to be prepared for that perimenopausal, menopausal time. And there's a lot of very safe ways to address the hormonal deficiencies in women. And we use a lot of what we call bioidentical hormone replacement. But there's a lot of providers in Charlotte that can certainly help to guide you with some hormone replacement in safe ways to help minimize that estrogenic deficiency. And lastly, and I won't go into too much detail, we can share these afterwards, maybe even send the slide to you, but there's 11 sort of, and there's more, but 11 that I kind of have our clients really focus on during, especially this time, or when they're traveling. We kind of prepare them a kit for boosting and maintaining their immune system function, helping their sleep, et cetera. So the goal of all these is understanding that many people are taking supplements and vitamins and maybe aren't really understanding the why and what they do. And so this is just a quick snapshot of that. And things such as vitamin C, it supports your innate and adaptive immune system. Vitamin D, it's an immune modulator. It actually almost acts like a steroid hormone when it is activated in your system. So it's got some anti-inflammatory effects. Melatonin, many people take melatonin because, quote unquote, it helps for sleep, but many people don't know that it's also hugely powerful for oxidative stress, and actually helps to affect that inflammasome that we've mentioned already. Glutathione, a huge, powerful antioxidant. It gets depleted when you have viruses, and so supplementing that, especially when you're getting sick, is quite effective. Resveratrol, which we all started drinking a lot of wine when resveratrol was sort of a buzzword, but the why of understanding resveratrol is that it seems to have some anti-aging effects and also seems to modulate this inflammasome. Nicotinamide and some of the derivatives that are also playing a role in immune system function. Zinc, low doses, no more than 25 to 50 milligrams, helps regulate our innate immune function. Quercetin, which is another what we call kind of flavanol. It's a very interesting molecule. This seems to have some effects on both RNA viruses, such as coronavirus and influenza, and DNA viruses. So it's a real interesting molecule. And then lastly, vitamin A, which we all know is in carrots and those types of things, but helps to, again, modulate the immune system. And then green tea and curcumin, hugely powerful as far as potentially targeting even one of the proteins that coronavirus has. Now, are these going to cure everything? No, but the idea is that if we can boost some of these in our system, and we're potentially exposed to not just coronavirus or other viruses, we're giving ourselves a little bit of a head start, plus with all the other anti-inflammatory things that we're going to do to help reduce inflammation in our system. So I will stop there. I thank you for letting me sort of talk for the last few minutes. I'm hoping as we do all the right things, we can get back. This is in Dominican Republic, where I'm from. It's a beach on the north side of the island. We all want to get back to normalcy and and have our little slice of heaven again and be able to travel. And I think collectively doing things like this is important to get the word out and hopefully start kind of bending that needle back to normalcy. So if anybody has any questions, I'm more than happy to answer now. And I'll take the screen sharing off for now.
All right. Thank you so much, Dr. Jorge. That was a great presentation. And I'm going to have to unmute some folks. I'm going to unmute everybody. Try to be, tell me if that works. You are unmuted. So you can now manually decide if you would like to chime in with a question. I just had one. Actually, there's one coming in chat now. Let me make sure I don't. Nope, that's just a great job. But I have one that has come in a separate route here, Dr. Jorge, and that is the role of sleep. And when folks, and we hear a lot about, COVID being a time when you should get enough sleep. And I hear loosely that has to do with our immune system and our repair. How does that interplay with some of these conditions that you're speaking on? And is that something that helps us sort of undo some of what's already there? Or is that just a precaution and a safeguard and a good thing to do? How does sleep play into all this?
Yeah, so there's a few things with sleep. Like for example, for our clients, we have a whole protocol that we provide to them. So, setting the same time every night for bed and doing an activity where you start to calm your brain down 30 to 60 minutes before bed. Cutting out things such as TV, iPads, iPhone, whatever device that you're on 30 to 60 minutes before. Potentially using a noise machine or some other sort of little machine that creates a sound while you're trying to get to sleep. Not drinking any sort of caffeine product after 12 or so in the afternoon. Maybe a light exercise late in the afternoon or early evening, avoiding heavy meals or lots of heavy alcohol use in the late evenings especially. Sleep is being shown more and more as, again, this restorative event for your body. It's allowing multiple systems to collectively take a break. And I'll give you one example. So I'm sure all of you have heard, or somebody has mentioned to you, I do intermittent fasting of 12 hours and 13 hours and 14 hours. And the question becomes, well, why are we doing that? And just to speak to that, it's, we want to give our insulin response a time to rest and normalize. And one of the ways we can easily do it is overnight while we're sleeping. That helps to control insulin, which when we're just continually spiking our insulin can act, as we call it, an anabolic type of hormone. It can actually cause growth, especially in, fat and weight and those types of things. Despite insulin being very, very important for controlling sugar, when it's dysregulated, it can trigger growth of things that we don't want. The other thing is that you're giving with healthy restorative sleep where your brain is actually entering into that deeper REM and deeper sleep, you're giving your body a sympathetic break. Okay, there's two systems in our body neurologically. There's the parasympathetic and the sympathetic system. And that sympathetic system is the one that makes us go. It's the one that we're on. If we're on, we're on. If we're stressed, that thing is activated. If you're worried about your kid who's about to get hit by a car, that thing goes into overdrive. But the problem is that we're constantly here. We're on a device all day. We're hearing news all day. We're talking to neighbors about everything going on, and we're not taking a breath for our system. And it's that parasympathetic breath that we need, which sleep allows us to also get. And so learning how to sleep deeply and learning how to sleep well, it sounds silly, but it's something that needs to sometimes be learned. And that, there's ways to do that. There's sleep tracking devices. So a lot of us are wearing, an Apple Watch or an Oura Ring or a strap or whatever, a Fitbit. And those are allowing us to be able to track our sleep. And if you haven't sort of really investigated into that, there's a lot of data out there now. There's a great researcher at Stanford who publishes on this all the time. His name's Matthew Walker. He's got a great TED Talk on sleep, if you'd like to see it, where he goes through a lot of the research that they're doing and the whys and the how of really improving your sleep. A personal anecdote I'll tell you, 2.5 years ago, I was probably in the highest stress position of my career, was not sleeping, I was not meditating, I was not probably eating as well as I should. And if any of your trainers out there, I tore my calf muscle 3 times. I tore my right calf muscle twice, and I tore my left calf muscle once. Combination of just fatigue, overtraining, and just not doing the right things. And so, now, I practice what I preach. I meditate twice a day. I certainly work on my sleep. It's a consistent battle for me, but I can tell you that from an injury standpoint and recovery standpoint, it's been way more effective.
That's really great. Thank you. And folks, I will circulate along with Dr. Jorge's contact info, that TED Talk. So anything else we grab, we'll make sure we package up to everybody. We did have another question coming from Sylvia. What would you recommend for breast cancer survivors related to hormone replacement? Is there a safe replacement?
It's it's a tough question. I will give you that there's no great randomized controlled studies that are being done on post breast cancer and bioidentical hormone replacement actively. I will give you the information that in Europe and in certain trials in Europe, there is a form of estrogen which is called estriol. So 3 types of estrogen really that our body has: estrogen 1, which is estrone; estrogen 2, which is estradiol; and then estrogen 3, which is estriol. They are using that in some studies in Europe, estriol, estrogen 3, in breast cancer treatment. Okay. Now, it's very controversial, but it's being done. I just mentioned it. In our clinic, what I would do with someone who has been through breast cancer, has been treated, is now in a remission state, and often depending on if the breast cancer is estrogen positive, estrogen receptor positive or not, we would have a very candid conversation about hormones and what we could do to potentially augment their hormones. There are supplements that we can do to potentially boost your hormone response, things such as DHEA, where we make sure that you're maximized and you're doing well with your thyroid and your cortisol, and all these other hormone systems are in place before we would just say, I'm just going to give you hormones. Okay. So we're really careful about that, especially in a breast cancer recovering client. Now, that said, if we have this candid conversation and we've checked off all these other hormone systems, and that client across from me says, look, I need to feel better. I don't want to have an increased risk of cardiovascular disease. I feel like I don't have a sex drive. I don't have libido. Then low, and slow of a bioidentical hormone, we would discuss it. I would talk about, all the legal things that we would cover. And those are conversations that I would have one-on-one with a client that would be very personalized and targeted. It is potentially still a risk, but I will tell you that there's been a lot of controversy about the hormones that were used in the studies that, 15 years ago in what was called Women's Health Initiative studies, which were all synthetic hormones and were hormones derived from horse urine, such as, equine estrogen. And so there's a little bit of a difference in the hormones that are used in the functional medicine world, which are typically produced from like sweet yam and other natural sources. But it is still active hormone. And so we want to be, cautious about that, especially in someone who's recovering from a cancer like that. Now, in someone who doesn't have a cancer, who's, going through perimenopause, menopause, again, we start out looking at kind of a matrix of things that interplay with each other, because hormone systems are not isolated. Hormone systems, interact with each other. And so if I touch the thyroid here, I may throw off some of the hormones down here. If I, address your estrogen only and don't address all this other stuff, I'm not really doing much. And quite frankly, at the end of it, if I don't address your gut, if your gut is not healthy, which is really one of the places we would also start with someone who's gone through breast cancer treatment or any cancer treatment, is healing the gut to then allow all these other systems to start working more appropriately. So lots we can do, but cautiously approach it.
Thanks, Dr. Jorge, and thanks for that question. It sounds like a lot of this will ultimately come down to your personal makeup, your personal biology, and what you've been through already. So certainly appreciate the complexity there. We've got a few more questions in the pipeline and plenty of time. You're next from your colleague, Leslie, wondering if the LDL goes up with adding good fats and with menopause.
With menopause, certainly you can see it go up, and some of the other inflammatory markers. That's been shown in studies. As far as with healthy fats, you can see a slight bump. For example, if you supplement fish oil, like omega-3, omega-6s, you can see a slight bump of LDL. But then when you break down LDL into either what we call large particles, small particles, and there's been a little bit of controversy back and forth in the cardiovascular lipidology community about this. But traditionally, for example, fish oil doesn't elevate the more what we call atherogenic or disease-causing LDL pieces. My approach in our clinic, for example, I tend to use a marker called apolipoprotein B, which is, it's the protein that all your bad cholesterols carry. And so there's a lot of research that has been looked at for that. There's a big trial that's been an international trial for years and years called the INTER-HEART trial. And the INTER-HEART trials, I mean, it's thousands and thousands and thousands of patients. And over, the number one risk factor for cardiovascular disease in that trial is apolipoprotein B. And so that's just the marker that I've used over the last now, probably 10 years. But there are others. But I would say if you're eating healthy fats, I would feel more confident and tell you confidently that your LDL may bump slightly, but from the inflammatory burden of it, I don't think you'll see such an effect. As if you increase your trans fats or you increase your sugars, et cetera, which would certainly bump that and other inflammatory markers.
Okay. All right. Thank you for that. I'll let you take a breath. We have another one. This one in the spirit of, I guess, customization and personalized medicine as well. LaGreta has asked or has heard that we need to take vitamins based on our own individual need. So how do we know what we are lacking or need? And would our doctor be able to help us with that typically?
Yeah, it's a good question. So there are a lot of companies out there now that quote unquote will personalize your vitamin profile, and then you can buy packets that are geared specifically for example, LaGreta in this instance. The challenge with that has been that the technology used by different companies can vary. And so in our center, what we do, we do look at, for example, micronutrient testing, we do vitamin testing, we do fatty acid testing. The challenge with these tests, number one, typically insurance doesn't cover these things. And so these are usually tests that we just provide to the client and then they just have to pay for on their own. They're quite good because then I can look and say, all right, micronutrient wise, you need to bump X, Y, and Z up, and really not worry about targeting so much the amount of vitamin that you may need. That said, we can go as deep as you want and really look at the vitamin levels also. We also have some companies that do, your vitamin deficiency on a deeper scale. And if you're interested, I can give you names of some of those. But, so there are ways that we can say, hey, you're fine on vitamin C. You're getting plenty of that. But you know what? Your vitamin D, which, can be checked multiple ways in the blood is one. You would need to supplement. So the answer is yes. There's a lot of companies doing it. Some are doing it really well. Some are doing it not so well. As far as if you just go to your normal provider, they may say, there's no real value in knowing that. In the functional medicine world, and personally, I tend to disagree. I think it's important to know. But I also would say, again, starting with how our gut is working is going to be a big driver of how these micronutrients and vitamins are going to be absorbed into your system and whether you assimilate them correctly. And so, really maybe if you're looking at where do I start, starting with looking at what we call your microbiome and looking at your gut and seeing, is that working efficiently and correctly? And if it is, then let's see what else you need. So again, we put all this together. When we talk about it, it's optimizing your health, it's personalizing your health, and that's a real drive for us to do. So.
Thank you, Dr. Jorge. Now you've said gut a few times, and I'm thinking we need a whole session on fixing your gut. And Leslie Ware, PA Alpha Health, is also on our line, your partner in this initiative.
Yep.
I think said a lot about that a few weeks ago. So I'm going to just park that thought. But if anybody on the line would like to hear more about guts, shoot a note over to the chat line, and I'll just start to take a tally. And that said, another question coming through, not through our chat, but through email, when it comes to those scans, so I may not know I have plaque. Help us with the lingo. What is the test that would be most helpful? Recognizing it may not be covered, or I may have a million reasons I don't feel like shopping around at offices right now. Can you give us some practical guidance on where we would go and what the name of that is and whether or not we're even allowed to get it?
Yeah, so the two tests I mentioned, and then I'll talk about some other services that are out there. So a CIMT, which stands for carotid intimamedial thickening ultrasound. It's a simple ultrasound that looks at both of your carotid arteries, okay? And traditionally, all of us have probably known somebody who has quote unquote carotid disease, and they're typically looking at the carotid like this, okay? They're looking to see, is there any blockage? We're not interested in that right now. What we want to identify is, on a cross section, in essence, horizontally, do you have plaque that's developing in your artery, okay? And that's really, really important, because if we already see plaque developing, then we can have a conversation that says, hey, we've got to change a lot of things to stop that plaque from progressing. And the beauty of that test, especially in the aggressive kind of preventative world, is that we can track that CIMT year to year or a couple years and see, is there progression occurring or are there changes occurring in that artery wall itself, okay? It's a very inexpensive test. It ranges anywhere between, I would say, $125 to $300, and you know, that's respecting that may be expensive for some folks, but in relation to some other diagnostic tests, it's very inexpensive. The other test I mentioned is a CAT scan. It's a very targeted CAT scan just of the coronary arteries around your heart, which is, you know, the arteries that are involved when you have a heart attack and those things. And so what that's looking at is calcium deposit in the artery wall. So in essence, the way to think about calcium in the artery wall, it's like a scar on your skin, okay? If I see you have calcium in the artery wall, it's telling me that you've already been forming plaque for a while, and we need to change some things to make sure that that deposition of calcium doesn't continue. And there's scoring numbers that we give to that. You know, it's 0 to 100, 100 to 400 and above. And then it's able to then be classified as you're in a higher risk if you're at this number, which would then trigger a different response. There are in the community often, especially at churches, there's a service that goes out. I think, you know, people may have heard it, like Lifeline, it's one. They go out and they do very simple ultrasounds. They'll do an atrial sort of response test and other things. But there are some other tests that you can do that are easier or simpler. There's even an ankle brachial index, which is just an ultrasound study that can be done. So there's lots of inexpensive ways to identify, do you already have some disease occurring? Now, if price is no option and you're like, I want the Cadillac of everything, well, yeah, you can go and there's a CT angiogram. It's a 3D, just recreating your heart, and it looks at all the structure. It's beautiful, but it's an insane amount of radiation, and it's not worth, I don't think, the cost for most people. But I caution our clients with, well, I had a stress test. A lot of people come in and they go, well, I had a stress test last year. I mean, I'm fine. Well, yes and no, right? So stress tests measure typically will be only positive if like 50% or more of an artery is affected. Okay, it's not going to tell you if you already just have a little bit of plaque forming. Okay, and unfortunately, there's lots of examples, both in people we know or famous people that they have a stress test and the next day they have a heart attack, and everybody goes, oh, but he had a normal stress test. Well, it's understanding that it's not just kind of blockage, it's the inflammatory variables that are there, it's the diabetes or the blood. I mean, there's a lot of other variables at play that will influence how that artery is responding to things. And I can give you more info if you need at some point.
Yeah, thank you. And for everybody's benefit, I know it's coming up. Let's see, we've got a few minutes left. I will show all of, in fact, why don't I do that now, Dr. Jorge? I'm going to share my screen while you're talking. So everybody has your contact info. Feel free to take a screenshot of this. And we'll continue with the questions while I get that screen up and running. There is one here about polyphenols. So the word polyphenol is thrown around. How does that play into, it might be the plaque question, but can you just give us a brief education, because that gets tossed around with blueberries and we're not sure what that is.
Yeah, so think of it this way, and we talk about eating foods with lots of colorings. The beauty of food as medicine is that foods that have lots of colorings and therefore have lots of polyphenols, which are antioxidant, which have anti-inflammatory effects, the more stressed a plant gets, or the more under duress a plant seems to be, or the more wild and organic a plant is, the more polyphenols and antioxidants it produces. And so, one of the things that we talk about in our practice is eating kind of that rainbow of different foods, eating as organically as possible, or learning how to even grow some of your own food in a little pot in your house. You can grow a nice little blueberry bush, or we let wild strawberries grow in our backyard. They're North Carolina wild strawberries. We don't spray anything. I don't use any weed killer or Roundup or any of those things. I've got my two kids and my wife and I, we go out and we pick weeds, and sometimes we just let weeds go and let those things go. So polyphenols are basically, look, they're going to be antioxidant. There's going to be some anti-inflammatory effect. Resveratrol and quercetin especially are being looked at and used in some of the, what we call DNA repair. There's a whole system that's called the sirtuin system, which helps to repair DNA, and that may help with some anti-aging effects. So lots of interesting research that's been done. Probably one of the biggest guys doing research in that, he's a guy out of Harvard. His name's David Sinclair, and he just wrote a book called Lifespan. It's a fascinating book where he talks about a lot of the research that he did, both with resveratrol, and now he's doing a lot of research with NAD, and there's some discussion about other polyphenols. It's a very easy book to read. I mean, he goes into some of the deep science, but he really breaks it down nicely. There's a lot of nice drawings and images. So that's a great kind of easy book to look at to get some more background. And then the other researcher that's doing a lot of research into just food as medicine and making sure you're eating the right things and how that affects longevity is a guy at USC in California. And his name is Dr. Longo, Longo, and he just wrote a book, also came out last year, called The Longevity Diet. And it's not really diet in the sense that most people say, oh, I'm on a diet. It's more just food as medicine, and he really has a lot of research being done and science, both into food, fasting, and all these other things that you can do. So.
That's great. Thank you, Dr. Jorge. And we are coming in on the end, and it looks like, other than a bunch of people saying they want to learn about guts, and I hear y'all, we're going to talk about that after. And by the way, we will also, in a follow-up, not only provide you a link to this video, but also the past video by Leslie Ware, who did address some of the gut question and how to keep that gut in working order for your host body. What you're seeing here in the way of staying in touch is contact information for Dr. Jorge and his clinic. Please note that Dr. Jorge, like our other partners in this initiative, are very active in the community. It's part and parcel to direct primary care. It's kind of why they do what they do. So you can catch a lot of videos if you want to follow his Facebook link. And these tags are just Companion Health. Note that when you're emailing or looking him up on the web, it's Companion Health NC. Otherwise, Facebook, just look for Companion Health. Feel free to send questions as well as for general questions on CareBridge or topics, just send those to me. And also note and be on the lookout for future e-blasts around upcoming topics that you see here on the right. And Dr. Jorge, any other, other than the resources which we'll summarize and send out, any other tips or parting thoughts you'd like to share with this great community that's always out there helping other people? We just really appreciate you helping them. So if there's anything else you'd like to add, please feel free.
Just right now, wear a mask, wash your hands, be safe. We'll get through this. But I think learning a little bit of stress management techniques goes a long way with all our clients. So I do think, incorporating a little bit of meditation, deep breathing, any of those Tai Chi, Qigong, any of those things that help to kind of calm your sympathetic response has huge effects long-term for the health of our clients and our members. So.
Great. Well, I think it's perfect timing. We'll give folks 3 or 4 minutes back. Thank you all so much. I hope that I know you all got a lot out of this. I certainly did. I have some big words I still need to look up, but I'm very grateful, Dr. Jorge, to have you out there helping people get not just manage the sick, but manage their health and let them feel like people, not patients. So thank you so much for all of you do, and thank you so much for your time.
Thank you for having me. I appreciate it.
You bet. I will close out, everybody.
Thanks, Dr. Jorge. Great job, partner.
Thanks, Leslie.
Thanks, Leslie.
All right.